about the postpartum period. So the postpartum period will begin immediately after birth, and then it ends in about 6 weeks after birth. So involution refers to the rapid decrease in the size of the uterus as it returns to its non-pregnant state. So the weight of the uterus will decrease from about 2 pounds to about 2 ounces, and then the uterine fundus will steadily descend into the pelvis, and so the fundal height will decrease about 1 centimeter per day. By about 10 days postpartum, the uterus should not be able to be palpated abdominally. Now, patients who breastfeed may experience a more rapid involution because of the release of oxytocin that occurs with breastfeeding. So lochia. Lochia is vaginal discharge after birth. So it's actual discharge from the uterus. It should smell like minces, and the discharge should decrease daily in amount, but it may also increase with ambulation. So from birth to about day 3, it's going to be very bright red discharge. From about day 4 to day 10, it's going to be a brownish pink. And then from days 11 to 14, it might be a white discharge. Now you have scant, light, moderate, heavy, and excessive amounts. So you can see the differences there. Know that heavy is a saturated pad in 1 hour, and excessive is when the pad is saturated in 15 minutes. Also, when it comes to lochia, know that any blood clots larger than 1 centimeter are considered abnormal, and the physician should be notified. So breast care for non-breastfeeding mothers. So for non-breastfeeding mothers, you want to avoid nipple stimulation. You want to encourage the use of a breast binder or wearing a snug fitting bra. Also, they can apply ice packs or take a mild analgesic for engorgement. Engorgement will usually self-resolve 24 to 36 hours after it begins. Now, in breastfeeding mothers, you don't really want to use ice packs. Ice packs may diminish the milk supply. And then if a patient is breastfeeding, that mother needs to increase her calories by about 200 to 500 calories per day. So in breastfeeding, uterine cramping may occur the first day after birth while the patient is nursing because of the oxytocin stimulation, which will cause the uterus to contract. If engorgement occurs in a breastfeeding mother, you want to breastfeed frequently, apply warm packs before feeding to promote milk, and then apply ice packs in between feeding. And you want to massage the breast. You do not want to use soap on the breast, so soap will increase the risk for cracked nipples. If a mother does experience cracked nipples, it's good to expose the nipples for air for about 10 to 20 minutes after feeding, and just rotate feeding positionings. Colostrum can also be used as a good moisturizer for the nipples. Also, as a side note, know that it is normal for a newborn stool to be light yellow, seedy, watery, and frequent. So postpartum vital signs. So it is normal in the first 24 hours after labor for a mother's temperature to increase to a max temperature of 100.4 degrees. This is just because labor is so dehydrating. Also, it is normal for their pulse to decrease to 50 beats per minute. Their blood pressure should remain normal, and their respiration should remain normal. Now, postpartum hemorrhage. Postpartum hemorrhage, some causes include uterine atony, which is when the uterus fails to contract after delivery of the baby, laceration of the cervix or vagina, hematoma development in the cervix, perineum, or labia, and then retained placental fragments can also cause postpartum hemorrhage. So uterine atony, like I said, uterine atony, it's when the uterus fails to contract, so it doesn't adequately compress large open vessels at the placental site. So this could result in hemorrhage. Assessment of uterine atony is going to be a very soft, boggy uterus noted on palpation of the uterine fundus. Interventions, the nurse is going to want to massage the uterus until it becomes firm, empty the woman's bladder, and then if symptoms do not resolve, you definitely want to notify the OB. And then elevating the woman's legs to a 30-degree angle may help as well. All right, mastitis. Mastitis is inflammation of the breast as a result of a blocked duct or infection. So it occurs primarily in breastfeeding mothers about 2 to 3 weeks after delivery, but it can occur at any time during lactation. So assessment, they're going to have very painful, tender axillary lymph nodes, localized heat and swelling on the breast. They may even have an elevated temperature. So interventions, you want to apply heat. Definitely educate breastfeeding mothers to continue feeding. And then you want to encourage manual expression of the breast milk, or you're going to want to encourage the mother to use a breast pump about every 3 to 4 hours.